Have you ever felt like your body was trying to tell you something but you just weren't listening? Not through words, but through subtle signs: a sudden ache, a strange fatigue, or a change you brushed off thinking it's just part of getting older. But what if those changes were more than just aging? What if they were quiet warning signals, urgent whispers from within that something deeper was going wrong? After age 60, every cell in our body becomes more vulnerable to imbalance. Our organs slow down, our systems, nervous, cardiovascular, endocrine, become more fragile, yet more interconnected. One small disruption can throw everything out of sync. And the real tragedy is, many people miss those cues until it's too late. As someone who has studied human health for decades, I've seen firsthand how one minor symptom, when recognized early, can change everything. Sadly, most people don't ignore the signs out of carelessness, but because they were never taught how to listen to their bodies in the first place. Here's the truth: your body and mind are deeply connected. A physical discomfort can lead to emotional stress, and prolonged anxiety or sadness can make physical symptoms worse. That's why learning to notice even the smallest shifts in how you feel is the first step toward longer, stronger, more independent living in later life. In this video, we'll explore some of the most overlooked but potentially life-threatening signals that older adults often dismiss. But don't worry, this isn't about fear, it's about empowerment. Because the earlier you spot these signs, the more control you have over your future. If you've ever had the feeling that something's not quite right, don't wait until it becomes a major issue. Start by making small but meaningful changes. Sleep better, hydrate more, get regular checkups, and most importantly, never hesitate to speak up when something feels off. Stay with us until the end, because what you're about to hear could not only protect your life but could save someone you love. And if you've ever experienced any strange or unexplained symptoms, we invite you to share your story in the comments below. We're here to listen. And don't forget to like this video, share it with someone who needs it, and subscribe to Healthy Living Daily so you never miss another life-saving health tip again. Have you ever woken up after what should have been a full night's rest, only to feel like you never slept at all? You're not alone, and it may not be something you can simply brush off. Let's build on what we explored earlier. When your body sends a warning, it doesn't always scream, it whispers. And one of the most alarming whispers it gives us is profound, unexplained fatigue. Not the kind of tiredness you feel after gardening or walking the dog, but a deep, lingering exhaustion that clings to you from the moment you wake up. It's the kind that makes getting dressed feel like climbing a mountain. It's the kind that doesn't go away with a nap or even a full night's sleep. This level of fatigue isn't just aging. As someone who has spent decades studying the intricate patterns of human health, I can tell you this: extreme fatigue without a clear reason is never something to ignore. It's your body hitting the brakes hard because something inside is faltering. When you feel this drained day after day, it could be your heart quietly struggling to keep up, or your kidneys working overtime, unable to filter waste efficiently. In many cases, it's the result of your vital organs entering a phase of distress long before obvious symptoms show up. And what's worse, most people, especially seniors, assume it's just part of getting older. That assumption is dangerous. Fatigue can also sneak in when your thyroid isn't functioning properly, when your blood is critically low in iron, or even when your immune system is fighting a hidden infection. Mentally, it can blur your focus, dampen your mood, and make every task feel heavier. Physically, it signals that your energy reserves are depleted, not because you've done too much, but because your body is trying to conserve what little it has left. Here's something I often tell patients: fatigue is not laziness. It's not weakness. It's information. Your job is to listen. So what can you do? First, pay attention to the pattern. When did the fatigue start? Is it getting worse? Does it ease up at certain times, or is it constant? Write it down. These details matter. Then, don't hesitate to book a full checkup. Ask for a comprehensive panel: blood work, heart evaluation, kidney function, thyroid check. Early detection truly saves lives. At the same time, make small but meaningful changes at home. Prioritize consistent high-quality sleep. Keep your meals balanced and nourishing, especially foods rich in iron, B vitamins, and magnesium. Stay hydrated, and most importantly, carve out time to restore your spirit, not just your body, because emotional stress can drain your energy faster than physical effort ever will. Remember, the line between just aging and something serious is thin but not invisible, and your best defense is awareness. If you've ever battled this kind of unshakable exhaustion, I invite you to share your experience in the comments. What did you notice? What helped you recover? Your insight could help someone else recognize the same signals in time. And if you haven't yet, please subscribe and turn on notifications so you won't miss the next life-saving message we share here on Healthy Living Daily. Because your energy matters, your life matters. Let's keep listening. Have you ever felt a sudden, crushing weight in your chest, like something heavy is pressing down on you from the inside? If that question made your heart skip a beat, good. Because sometimes, that sensation is far more than discomfort. It's your body begging for immediate attention. And yet, too many people dismiss it. Following the fatigue we discussed earlier, chest pain, especially when it strikes out of nowhere, is one of the most urgent red flags the human body can throw. It's not always a sharp stab. Often it feels like intense pressure, tightness, or heaviness. It may spread to the left arm, up to the jaw, into the neck, or even radiate into the back. Whether it comes gradually or hits like lightning, one thing is clear: it should never be ignored. This kind of pain is not your body being dramatic, it's your body in crisis mode. The most common cause, as many already know, is a heart attack, when blood flow to part of the heart is suddenly blocked, starving it of oxygen. But as a health expert who has reviewed countless emergency cases, I can tell you that other equally life-threatening issues often get overlooked. Aortic dissection, for instance, a tear in the major artery leaving the heart, can present almost identically but is even more fatal without immediate surgery. Pulmonary embolism, severe angina, or inflammation around the heart, pericarditis, can also mimic the same terrifying feeling. What makes this more dangerous is how often people rationalize it away. They chalk it up to acid reflux, stress, gas, or fatigue. They lie down, take an antacid, and wait. Some may even go to bed, hoping to sleep it off. But in the case of a heart attack or aortic rupture, minutes matter. The longer your heart or arteries are starved of oxygen or stability, the greater the damage and the smaller your chances of survival. Here's what I tell every senior patient I counsel: you do not need to be sure it's serious before you act. You only need to know that it might be, and that's enough. Your mental response in those first few moments can determine the outcome. Choosing not to call for help out of fear, embarrassment, or pride can be deadly. The stress of uncertainty can even compound physical symptoms, creating a cascade of inflammation and cardiac strain. So what should you do? At the very first sign of sudden or intense chest pressure, call emergency services immediately. Don't drive yourself. Don't wait to see if it passes. Getting rapid care gives doctors the best chance to stabilize your condition, open blocked vessels, and prevent irreversible damage. In prevention, it starts with daily care. Monitor your blood pressure. Keep your cholesterol and blood sugar in check. Don't skip your medications. Move your body regularly. Eat heart-supportive foods like leafy greens, nuts, and omega-3 rich fish. But above all, listen. Your body doesn't whisper like this without reason. If you've ever had a frightening episode of chest pain, we'd love to hear your story in the comments. Your experience could give someone else the courage to act faster. And if this video is giving you tools you wish you'd had sooner, please like it, share it with a loved one, and subscribe to Healthy Living Daily. The next few minutes might just save a life, because every heartbeat matters. Have you ever had that sudden, terrifying moment where, no matter how deeply you inhale, the air just doesn't feel like it's getting in? It can happen when you're simply sitting in a chair or lying in bed, no exertion, no warning. Suddenly it feels like you're breathing through a straw. That sensation, that gripping tightness in your chest, or the overwhelming urge to gasp for air, is not something to brush off, especially if it happens at rest. In our last discussion, we explored how chest pain could be your body crying for help, shortness of breath, or what doctors call dyspneas, another critical warning sign. But unlike the sharp pain that might send someone to the ER immediately, this one is often minimized or misinterpreted, especially by older adults. Many seniors assume that feeling winded is just part of aging, or the result of being out of shape. But here's the truth. You should not feel breathless while resting, dressing, or doing light tasks. That's not age, it's a red flag. Clinically, unexplained breathlessness may be tied to serious conditions like congestive heart failure, where the heart fails to pump blood effectively, leading to fluid buildup in the lungs. Another silent threat is pulmonary embolism, when a blood clot travels to the lungs, cutting off oxygen. Sometimes, shortness of breath can even be the first and only sign of a silent heart attack. Infections like pneumonia or advanced lung conditions like COPD can also trigger this sensation, and, if untreated, they can turn deadly in seniors within days, sometimes hours. Here's where physical and emotional health begin to intertwine. Breathlessness doesn't just affect the body, it stirs panic, anxiety, and fear. And ironically, these emotions can make the breathing problem worse. You become trapped in a loop. Fear tightens your chest, which worsens the breathlessness, which increases fear. Recognizing this cycle early is critical. So what can you do to protect yourself? First, awareness is your frontline defense. If you or a loved one starts experiencing shortness of breath, especially if it's sudden, severe, or accompanied by dizziness, chest discomfort, or fatigued, don't wait to see if it passes. Sit down, stay calm, and call emergency services immediately. If the cause is something life-threatening like a clot or cardiac event, minutes matter. Prevention starts with keeping your lungs and heart strong. Avoid smoking entirely. Get regular checkups. Stay active with low-impact movement like walking or swimming. And focus your diet on anti-inflammatory, heart-lung supporting foods like leafy greens, berries, and healthy fats. And perhaps most importantly, don't normalize symptoms just because they're common. There's a huge difference between common and safe. If you've ever experienced unexplained breathlessness at night, after a meal, or simply walking across a room, drop a comment below. Let's start a conversation, because your story might help someone recognize their own risk in time. And as always, don't forget to like this video, subscribe to Healthy Living Daily, and turn on notifications. The next symptom we cover might be the one that saves a life, maybe even yours. Let's keep learning. Let's keep listening. Have you ever stepped on the scale and realized you've lost weight without even trying? At first, it might seem like a pleasant surprise. If you've always hoped to shed a few pounds, your pants fit looser, your belt needs a new notch, and friends start commenting that you look slimmer. But when weight loss happens suddenly, without any changes to diet or activity, especially in older adults, it can be far from good news. In fact, it can be one of the most subtle, yet alarming red flags your body sends out. Building on our previous discussions about chest discomfort and shortness of breath, unexplained weight loss adds another urgent layer to the picture. And as a clinician who's worked with aging populations for decades, I can't stress this enough. If the weight is falling off, and you don't know why, your body might be fighting something far more serious than you realize. From a medical perspective, this kind of unintentional weight loss is often linked to conditions that disrupt your body's ability to absorb nutrients, regulate metabolism, or maintain muscle mass. Yes, cancer is high on that list. Pancreatic, lung, gastrointestinal, or even blood cancers can quietly consume your body's energy reserves long before any pain or lumps appear. But it's not just cancer. Poorly controlled diabetes, overactive thyroid, advanced heart failure, and chronic infections can all cause the body to burn calories faster than you can replace them, even when you're eating normally. What's dangerous is how often this gets dismissed. Many seniors believe they're just getting older, or they blame a lack of appetite, or even consider it a welcome change. But the truth is, healthy aging does not mean withering away. Muscle mass, weight stability, and energy are key markers of vitality. When the body starts shedding pounds without permission, it's not a dietized distress. There's also an emotional component here. As weight drops, energy often follows. Weakness sets in. Confidence erodes. You may find yourself avoiding social events, withdrawing from your favorite routines, or becoming anxious about your health without really knowing why. This mind-body connection can quietly sabotage both your immunity and your independence. So what should you do? Start by tracking the numbers. If you or a loved one loses more than 5% of body weight over a few weeks or months and there's no obvious reason, it's time to take action. Don't wait. Schedule a full medical evaluation, including blood tests, metabolic panels, and imaging if needed. Ask your doctor to look beyond the surface, because early detection can mean the difference between a minor adjustment and a life-saving diagnosis. Start at home. Focus on maintaining a balanced, nutrient-dense diet. Don't skip meals. Include protein in every meal: eggs, legumes, yogurt, or lean meats. Hydrate well, and don't ignore changes in your mood, energy, or eating patterns. If this message hits home, we invite you to share your story in the comments. Have you or someone you love experienced sudden weight loss? What was the outcome? Your voice might inspire someone else to take action. And as always, subscribe to Healthy Living Daily, like this video, and turn on notifications. The next signal we discuss could be the one that protects your life or someone else's, because every pound you lose unintentionally could be a clue your body needs you to notice. Have you ever looked into the eyes of someone you know and loved only to realize they suddenly seemed like someone else? It's a deeply unsettling moment. Maybe they forget a name they've said 1,000 times. Maybe they can't find their way home from a familiar store. Or maybe their personality shifts once calm and cheerful, now irritable, withdrawn, or even paranoid. You might think, maybe it's just age catching up. But here's the truth. Sudden confusion, disorientation, or changes in behavior are never just aging. They are neurological red flags that must be taken seriously. Coming off our last discussion on unexplained weight loss, this next symptom strikes closer to the mind than the body, but the two are deeply connected. When the brain starts to falter, the body often follows. As a lifelong health researcher, I've seen how easily families dismiss early cognitive shifts. They chalk it up to forgetfulness, or stress, or having a bad day. But when changes in speech, memory, or personality occur suddenly or get worse over a few hours or days, it's not a fluke. It's an emergency. Medically speaking, this kind of mental change could point to conditions like stroke or a transient ischemic attack, TIA, often called a mini stroke. These can cause short-term confusion or speech difficulty, and often precede a much more severe event. Brain infections like meningitis or encephalitis are also culprits, especially in older adults whose immune systems may not mount typical responses like fever. Even a urinary tract infection, UTI, which sounds minor, can spark acute delirium in seniors, without ever causing pain or burning. And then there's the terrifying possibility of fast-moving neurodegenerative disease like early-onset Alzheimer's or other forms of dementia. These don't always start gradually. In some cases, a seemingly healthy person changes within weeks. Here's what most people miss. The brain is a highly sensitive organ, and even small imbalances in hydration, blood, sugar, or medication can wreak havoc. Confusion can be caused by low sodium, a new prescription, or untreated diabetes. That's why acting quickly is critical, not just for treatment, but to prevent permanent damage. So what can you do? If you notice sudden memory loss, strange behavior, difficulty speaking, or signs of disconnection, don't wait and see. Go to the ER, call your healthcare provider. Ask for neurological evaluation, lab work, and possibly brain imaging. Every hour matters when brain function is on the line. At home, prevention means staying mentally and physically active. When encourage hydration, manage chronic conditions closely like diabetes and hypertension that silently affect the brain. Maintain regular checkups and stay aware of any cognitive shifts, no matter how small. And just as important, stay emotionally connected. Isolation accelerates cognitive decline. Social engagement, creative hobbies, and mental stimulation can help maintain clarity and protect brain health longer than we once believed. Have you or someone you love ever experienced sudden confusion or a personality change? Share in the comments. Your experience could be the insight that saves another family from heartache. If this content is helping you understand aging in a new light, please like this video, subscribe to Healthy Living Daily, and turn on notifications. Because when it comes to the brain, every second counts. Let's keep our minds and each other safe. Have you ever felt a deep gnawing pain in your abdomen, one that doesn't go away and keeps getting worse? It's not the occasional cramp or discomfort after a heavy meal. It's sharp, persistent, and unsettling. Maybe it started as a dull ache, but now it's radiating to your back or flanks. Your stomach feels bloated, tender to the touch, maybe even hard as a rock. This isn't indigestion. It's your body signaling something far more serious, and ignoring it could cost you your life. Coming off our previous discussion about sudden confusion and neurological shifts, we now turn to another overlooked but critical symptom: severe and persistent abdominal pain. From a clinical standpoint, this kind of pain can be a red flag for a number of life-threatening conditions, many of which escalate rapidly and require emergency intervention. One of the most dangerous is a ruptured abdominal aortic aneurysm, where a weakened section of the body's main artery bursts, causing massive internal bleeding. But it's not the only risk. Intestinal blockages, gallbladder inflammation, acute pancreatitis, or restricted blood flow to the intestines known as mesenteric ischemia are all conditions that can present with intense abdominal pain. What makes this so dangerous is that many older adults downplay abdominal symptoms, attributing them to gas, constipation, or something they ate. There's a common but risky assumption that bloating, cramping, or discomfort are normal parts of aging. They're not, and waiting to see if it passes can lead to devastating outcomes. Here's the truth. Your abdominal organs are tightly packed, deeply interconnected, and highly sensitive. When one begins to fail, others quickly follow. An untreated bowel obstruction can lead to tissue death. A ruptured aneurysm can cause death within minutes. Pancreatitis can progress to multiple organ failure. Even a simple infection in the wrong place, at the wrong time, can lead to sepsis. And here's where mind and body intersect again. Pain affects more than tissue. It affects focus, sleep, mood. Prolonged abdominal distress can lead to irritability, confusion, and emotional withdrawal. For seniors, this makes diagnosis even harder, as they may downplay symptoms out of fear, embarrassment, or even cognitive decline. So what should you do? If you or someone you love experiences sudden or severe abdominal pain, especially with vomiting, fever, dizziness, or changes in bowel habits, do not wait. Go to the emergency room, get imaging done. Advocate for thorough blood work and evaluation. Time is everything when it comes to internal organs. Home. Pay attention to patterns. Don't ignore new or intensifying pain. Stay hydrated. Eat foods rich in fiber to support healthy digestion. Manage cardiovascular risk factors like high blood pressure, which increase your risk for aneurysms. And never self-diagnose persistent pain. Have you ever experienced unexplained abdominal pain or helped a loved one through it? Share your insights below. You could help someone recognize the signs early enough to make a life-saving decision. And if you're finding these health tips helpful, please like this video, subscribe to Healthy Living Daily, and turn on notifications. In the next part, we'll uncover the final symptom you must never ignore, because your body speaks. The question is, are you listening? Your body is always speaking. Will you listen before it's too late? Now that we've explored 7 critical symptoms, no one over 60 should ignore: extreme fatigue, sudden chest pain, unexplained shortness of breath, significant weight loss, mental confusion, abdominal pain, and changes in behavior. You're hopefully beginning to see the bigger picture. None of these symptoms should ever be brushed aside as just getting older. While aging naturally comes with change, sudden, persistent, or unexplained symptoms are never normal. They are often the body's way of urgently waving a red flag, asking you to stop, notice, and act. What often begins as a minor annoyance like discomfort, tiredness, or forgetfulness can silently be the first sign of something far more dangerous. Ignoring or delaying action could lead to permanent disability, loss of independence, or even death. But here's the empowering truth: early detection saves lives. Quick action doesn't just prevent crisis, It can help you reclaim your vitality and enjoy more meaningful years ahead. So if you or someone you care about is experiencing one of these warning signs, don't wait. Schedule a doctor's visit. Go to urgent care. Talk to someone. It's better to find out it's nothing than to discover too late that it was something. That we hope this video has not only informed you but inspired you to take your health more seriously, because you deserve to feel strong, alert, and alive, not just to live longer, but to live better. If something in today's message resonated with you, please share your thoughts or your experience in the comments below. You might be the voice that helps someone else take action in time. And if you found this video helpful, give it a thumbs up. If not, that's okay. Leave us a and tell us what we could do better. Either way, your feedback means the world to us. If you haven't already, consider subscribing and turning on notifications so you won't miss future health tips that could save your life or someone else's. Stay aware, stay connected, stay well. You matter more than you know.